we're joined here with Dr. Elvis Seman. He's a gynecologist from Australia, the chair of MaterCare Australia, and a board member of MaterCare International. Dr. Seman, thank you very much for joining us. And my question to you this evening is, how will the MaterCare International Hospital that's recently opened in Isiolo and set to open on the 14th of June impact the community which it serves?
I think that it's going to impact enormously at a number of different levels. Firstly, if you look at the history of the hospital, the project was begun after the former bishop, now the late Bishop Lokati, was searching the internet, looking for a means of finding a manner in which to reduce the injuries and deaths resulting from normal childbirth in Isiolo, and he came across MaterCare International. It was in about 2005 that he made contact with Professor Wally and asked him to do something about this, please. And so really, with the opening of this hospital, we are seeing the fulfilment of his dream that's to be done to help the local people. He had a great love for the locals. He was killed, sadly, in 2005. So I would begin by saying that it's very much the fulfilment of a dream, and one that the whole community has shared. It's going to impact also on how mothers are treated in the area. This is a hospital in a predominantly Muslim area with some Christians, and all women will be welcome, irrespective of their religion or financial status. It's going to impact, I think, most of all on family units, and I'll explain this. Isiolo has a maternal mortality rate of about 1 in 19, so that means that during a woman's reproductive life in Isiolo, she has a 1 in 19 chance of dying as a result of pregnancy or childbirth. Virtually all of these causes are preventable and or treatable. Now, in Isiolo, when a mother dies, the whole family dies. This is because that mother has several young dependent children, which often can't be cared for by the father because he's out fending for the family. So the death of the mother means the death of the family. And the opposite applies. When you save a mother, you save the whole family. And so we're talking about salvaging whole family units, which are the building block of society. And so this hospital will impact enormously in many ways on that community, and it's going to be very positive.
Right, and you were saying this is the fulfillment of a dream or a wish, and I think that our viewers might need to understand how little was there prior to this hospital being built. If you look at some of the images that we've brought back, there was nothing before this hospital was erected. And what has been sort of your impression or experience from how people have reacted to this hospital being built?
I was in Kenya recently in Isiolo in April and back with my wife. And we met a lot of people and we went to church. And there was a great sense of expectation for this hospital. Now, to answer your question about how women have delivered and how they're delivering now, it works completely differently to what it does in Western society. Most women deliver at home, either alone or with a traditional birth attendant. Those attendants are more often than not illiterate, and they've had a little bit of experience but no special training. And when there is a problem, often there is a delay in detecting that problem during childbirth. Then there is the problem of transport and communication, being able to tell someone about the problem and get that mother to help. The hospital is the centrepiece. So the model of obstetric care that's being implemented in Kenya is one which was developed by Dr. Robert Wally of Canada in another country, Nigeria, and now it's been reproduced elsewhere. And this model has been found to significantly reduce the rate at which mothers and babies are either injured or die during pregnancy and childbirth. How this will impact in Kenya is as follows. First of all, the traditional birth attendants will be better educated to identify high-risk mothers who need special care. Secondly, they're provided with a means of communication and a mode of transport to move those mothers promptly to the care that they require. And this hospital is really the centrepiece. Those mothers will be referred to this hospital for care. And as I mentioned earlier, this model has worked extremely well, and we are confident that it's going to impact significantly on this high maternal mortality rate.
Yes, and you spoke a little bit there about the traditional birth attendants and their role. They already exist in the community, and MaterCare is actually integrating them into working with this hospital. So it seems that it is community-based and that the community will not only get the benefits, but also be an integral part of the hospital's working itself. Is that true?
Yes. It's critical for long-term success that the community is involved. Hence, MaterCare is presently hiring staff, including a Kenyan obstetrician, midwives, and other relevant staff. And whilst we're an international group, our aim is to eventually hand over control completely to the Kenyans so that they will take ownership of this. And that's going to be really important for long-term sustainability of the hospital.
Excellent. Dr. Seman, thank you so much for your time.
You're very welcome.